Good afternoon, everyone. This is Karen Bowles with the Virginia Early Childhood Foundation, and we are delighted so many folks could join us this afternoon. I wanted to go over a few housekeeping items to make sure everyone can participate fully. When you joined today's webinar, you selected to join either by phone or computer audio. If for any reason you'd like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is also being recorded. All participants have been placed on mute for quality assurance, but you will have the opportunity to submit text questions to today's presenters by typing your questions into the question pane, also on the control panel. You may send in your questions at any time, and we will collect them and address them during the Q&A sessions throughout the webinar. And so with that taken care of, I am really pleased to introduce our first two speakers, Commissioner Duke Storen with the Virginia Department of Social Services, and Jenna Conway, the Chief School Readiness Officer at the Virginia Department of Education. And they will be covering quite a bit today, talking about current efforts to support childcare and school-age childcare, and then also looking ahead to the new stimulus relief bill and how those funds will be shaped, and we will be seeking stakeholder perspective on that during the call. So with that, Commissioner Storen, welcome, and Jenna, welcome. Thank you very much.
Thank you so much, Karen, and good afternoon, everybody. Really appreciate the opportunity to participate in today's webinar. Before we begin the presentation, I just wanted to take a moment to thank each one of you for the incredible service you provide to our children. You can't overstate that our children are really our most precious gift. And we put their lives and their well-being into your hands every day. I believe that each of you and your colleagues who are providing care have been true heroes of the pandemic. Without you, our essential workers couldn't perform their essential jobs. We'd be without healthcare, food, transportation, safety. And having been in the room and on numerous Zoom calls with both the governor and First Lady, I know they share this appreciation and admiration for the work that you're doing. So really, thank you so much. I also wanted to take a minute to thank Kathy Glazer and the entire VECF team, who has also shown amazing resiliency and a willingness to go the extra mile to partner with us in state government to help support you. When we first started our direct incentive and stabilization grants, we quickly ran into problems with clunky, old, 50-year-old clunky state systems, and we just couldn't process checks fast enough. And I know that was frustrating for many of you. And VECF stepped forward, found a solution, and continues to provide those services on our behalf to this day. When we needed to quickly find solutions to the complex challenge of providing childcare to school-age children, VECF was back, willing to use their Smart Beginnings Coalition to convene stakeholders, work with you and the provider community and local governments and school districts and families to begin the process of helping solve this problem. And we'll talk more about that today. So Kathy and Team VECF, just a real heartfelt thank you for your partnership, your hard work, and your willingness to tackle the tough challenges before us. Today, Jenna Conway, who's the state's Chief School Readiness Officer and honestly one of the nation's foremost experts in early childhood education and policy, and we're thrilled that she is with us in Virginia to help us navigate these really difficult waters. We'll offer a brief presentation showing how we've invested the various pots of stimulus funds, some of the lessons that we've learned along the way, and then really focus on the challenges and what I think are terrific opportunities we have moving forward. But we want today to be a dialogue and not just a presentation. We want to hear from you about your experience, about what you need, and most importantly, how we can better support you. So while we're getting our presentation over the next few minutes, start gathering those lists of ideas or complaints or other creative solutions to the problems before us. You know, we're pretty thick-skinned, and we can take a good suggestion any day. We know that we're all in this together to solve these difficult challenges, and the experts are you who are on the webinar today. So if we could go to the next slide, please. So a lot has happened over the last 10 months, and we thought we'd offer sort of a high-level overview of the funds that have come to Virginia and the strategies that we've used to take advantage to support the early childhood education sort of industry, both in schools and out of schools. On the education side, we have invested $10 million across sort of VPI, professional development, and the mixed delivery program. So, we kind of got rid of some of those wait lists and added community provider add-ons and put together a 3-year-old pilot with VPI, invested more in professional development and coaching, and expanded the mixed delivery and supported the mixed delivery program. We've also thought we were going to have to stand up emergency childcare within school buildings. Right when the pandemic hit, that was a strategy we thought we were going to have to turn to because we weren't sure how many providers would be able to stay open to support essential employees. And because of the heroism and the resilience that the provider community has shown, we really didn't have to execute that strategy. So we see that $16,000 as a real win because we're able to continue to support the good work that you do. And then sort of federal to Head Start, there's been an investment of $12.3 million. And we would like to see more Head Starts be able to expand their capacity moving forward. We see that as a challenge. On the social services side, again, this is really just how the money flows within the state government. Every one of these decisions has been a joint collaboration between the Department of Ed, the governor's office, and the Department of Social Services. Jenna and I, we're on speed dial, as they say, or Zoom dial, and have really thought through this and been learning and working at this together. Our primary strategy that we think has had the biggest impact has been a direct grant strategy to providers, providing you with the flexibility to spend additional dollars in the ways that you need. That can take the form of PPE, it can take the form of incentives for staff to come back in, it can take the form of just making up the gap between the amount of children you're able to serve because of the public health conditions and how many you typically serve. So you can see here both at the top, the CARES Act, VSCC, DBG, Child Care Development Block Grant. We put in 2 rounds of funding at $54 million. And then we completed a 3rd round at the bottom, CARES Act 3. And we put out another $54 million. And we are continuing to take applications for those that haven't received a CARES Act grant to date. And we anticipate putting out another $15 million. We'd love to hear your feedback about all these strategies, including the direct grant strategy and our dialogue. We also, for a period of time at the beginning of the pandemic, increased our paid absence days. We think this was a really effective policy. It's one that we're considering bringing back with the new investment of funds coming from the federal government. We'd like to hear, again, some more feedback from you on that. We also eliminated co-payments for a period of time for families with children in the subsidy program, and we increased the maximum reimbursement rate for level 1 providers. That rate will be in place for another year and a half or so at a minimum, and so we're just starting to see those funds being expended. And finally, we put out through VECF and into the Smart Beginnings Coalition the ability to spend up to $33 million in funds to support school-age childcare. And we know that that's going to look different in different places. You know, some might need to go to staffing, some could go to existing providers to expand their services. Some people need physical space. It's a dynamic, changing demand in the community based on the decisions that schools are making, and every community and really every neighborhood has different assets in terms of both labor and physical space. So we know it's a complex problem to solve. We have some money out there to solve it, and we'd like to hear how we can better support you and the Smart Beginnings Coalition in doing that work. Next slide, please. So, you know, we've learned a lot, and we want to continue to learn more. You know, one of our key findings or key lessons learned is that the current funding model based on attendance really creates a fragile and fragmented system. By providing the direct grants and looking at other types of strategies like contracts and having you know, a lot of absence days available in the subsidy program can put more stability into the system, and you know, we are looking for some input on how we can better do that. We believe that direct cash assistance has helped reopen childcare in Virginia. We have about 84% of providers who were open before the pandemic are now reopened. And we know that you all play a key role in supporting both virtual and hybrid learning. Next slide, please. So about 2,000 programs in Virginia have reopened, and this shows a snapshot of where we were at the peak of the crisis, not the public health crisis, but the peak of the crisis of having so many child care and other early learning facilities close, and where we are today. So we've made great progress, and we do believe that the majority of that progress has been made because of the direct grant support. Next slide, please. So I think I'm going to turn it over to my colleague, Jenna Conway, Chief School Readiness Officer. Thank you.
Excellent. Thank you, Commissioner Storin. And again, I want to echo the appreciation for the Early Childhood Foundation and the incredible work that they've done. Our panelists who are joining us today, who I know will help share insights as we continue to figure out how to work together, and certainly all of the providers who have been, as the commissioner noted, the heroes of this pandemic, who've been on the front line. And we know through listening sessions, through conversations, through emails, you've let us know the challenges you face. We are very excited to see so many of our programs reopened, but we also acknowledge that challenges remain, and hearing about these challenges will be important as the Department of Social Services, the Department of Education, and the Governor's Office figure out how we deploy or use future resources to solve the problems. A few of the things that we've heard of late is that while we have done a good job and are ahead of the national average in terms of reopened programs, as Commissioner Storin just showed you, many of you are still under enrolled. So your doors are open, your lights are on, some staff are back, but you may be still struggling to make payroll, address all the costs. Again, I think speaking to kind of the fragility of the system already, the margins in childcare were razor thin before the pandemic. And when you have things like half attendance, it just means that you are in many ways losing money, whether you are a for-profit and you're going through your savings, or even you're a nonprofit, right? And just your ability to operate is more and more stressed each day. And so as we think about going forward, one of the things that worked really well with the direct cash assistance was allowing you, it was funded based on kind of your overall capacity and providing the utmost flexibility. So whether you need it for payroll, whether you need it for utilities, whether you need it to kind of make up for when parents have to keep kids home because of fears, making sure that we recognize that you're both oftentimes under enrolled and you have additional costs, like due to all the safety precautions, right? Keeping kids and adults apart, more staff to support entrances and exits, more staff to support kind of distancing, less ability to double up classrooms, all of those things that we know that you're doing to keep your kids, your educators, and your family safe. So that's one thing that loud and clear we've heard. The numbers might look back in terms of who's open, but it is still a very, very difficult, if not nearly impossible, environment in which to operate. And you feel that in terms of your bottom line. We know that, and Commissioner Storin and I have heard this both, particularly in the last week or so, like we have to address the safety crisis. And there's sort of no amount of money that will be sufficient until we really make sure that we have things in place to keep your staff, and keep your families and your kids safe. And so we have worked very closely with the Department of Health to make sure that we shared all of the child care numbers. We counted all of the licensed centers, everybody who was known to us, all the family day homes. We've shared that information with the Department of Health. We've sent it down to the zip code basis to all the various offices. We wanted to make sure that you were included in 1B, along with school teachers and all of the other essential workers who came in right after our healthcare professionals. But I will acknowledge that the available supply on the ground in Virginia right now is limited, and I know that's extremely frustrating, as many places are finally opening up to 1B, and it's difficult to get a spot. And so continuing to recognize that we have to keep you all as a priority for vaccines, and until we can get everybody vaccinated and it feels safe to operate, it'll be expensive, right? More expensive to operate, and you're still going to have families who are not going to come back, right? Until there's more vaccines available. And lastly, and this is a finding we've really heard from the fall, nearly universally across the state, is finding and retaining staff has become much more difficult. I think whether it's the number of staff who have underlying medical conditions and can't work directly with kids and families anymore, whether it's because we've spread out the kids, right, with the pods and the tutors and the nannies and all these things, right? We've got sort of smaller group sizes across the Commonwealth, meaning that we need more adults per kid than we would typically need. And so we keep hearing that it's really hard to keep staff. It's really hard to find staff if somebody has to leave or go on medical leave or something comes about. And so really, again, thinking about how we can support those efforts. We would love to hear your ideas there. We wanted to kind of echo back that I know that that's a very significant challenge. One of the biggest indicators for kids coming to school ready is like being able to develop trusting, loving, safe relationships with adults who help them learn and grow and develop. And if you have a constant churn of adults, it's a lot of work for you, and it's not great for kids. And so really thinking through together how we can help you address that challenge. Karen or Morgan, if we move to the next slide, please. So the good news from the Office of the Governor, the Department of Social Services, and the Department of Education is that there is a significant amount of new funding available. And we wanted today, and we'll hear from folks, to help understand your thoughts on how to best use the just under $200 million that Virginia is expected to use that is explicitly designated for childcare. When you think back to Commissioner Storin, the chart he presented earlier, these are dollars that go out directly to childcare, that particularly that left-hand column, and we are committed to getting those out to you quickly and to address your most pressing needs. We have a little bit of time to spend the money, although I think, as you'll see, in our kind of past practice, there's a real urgency around getting them out to you now because you need them now. And to that point, we want to hear from you today because we need to report back to DC by the end of February our plan for using these funds. So this is real time. Us hearing from you today will help shape Virginia's approach and Virginia's plan for using these dollars and making sure that we can provide immediate relief to you, to your teams, to your kids, and to your families. Next slide, please. So key point as we go forward, just one more sort of note, and partly as Commissioner Storin noted, we've been working very, very closely and working very closely as well with the First Lady's office. You probably all are familiar that this formal oversight for childcare will transition to the Department of Education on July 1st of this year. And we wanted to jointly reassure you that as we have been working together over the last 11 months, so we will do so for the next year and beyond, that we don't want to let this transition get in the way of our recovery efforts. So as of July 1st, the Department of Education will set policy for all aspects of childcare, and we will operate licensing and quality improvement for childcare. The Department of Social Services, we will work very closely with them, but we will contract with them to continue to operate the child care subsidy program. So as we make changes to child care subsidy, for example, if we were to pay for more absence days or increase rates, there's no reason to expect that that would change or be disrupted or in any way, shape, or form be a disruption for you or for your families on July 1st. So really wanted folks to understand it will continue to be a partnership and that the subsidy program will continue to be run by the Department of Social Services, although under the oversight of the Department of Education. But we are both jointly committed, and you can hear this from us today, to making sure that this is seamless and the transition doesn't cause any disruptions as you're seeking to build back better. And with that, I think what we would love to hear, and I'll turn it back to our host, is to figure out from you and to maybe some of the sharing from what's in the chat, but what's worked well. What's worked well in terms of the cash assistance or some of the other programs, where there's still gaps. We know we've heard about vaccines, we've heard about staffing, we know you're still under enrolled and have high operating costs, but are we missing something? We know that we want to kind of make sure that we get this direct cash assistance to every last program who's eligible. We want to continue to really address your needs, and so let us know where there are gaps. And then as we go forward, I think both the Commissioner, myself, the First Lady, the foundation, others really want us to build back better, right? We know it was a fragile system on March 1st of last year, and as we rebuild and we smartly and strategically use these dollars, are there things that we can do differently going forward to help build a more stable, more sustainable, more resilient child care sector in the Commonwealth? I also put at the bottom here an email for those who may not get their questions in or want to send us feedback separately. I can make sure this gets to both the Commissioner Storin and myself if you use that email address. So I think I'll turn it over to our facilitator to see if there's any questions or queries or feedback now, but also wanted to share that email address for anybody who might want to send something in.
Thank you so much, Duke and Jenna. A wealth of information, and likewise, we have a wealth of comments and questions. So let me pitch some of those to you. First, multiple comments expressing tremendous gratitude, appreciation, thanks for the direct cash grants. Those have been really meaningful and sustaining for providers. They would like to see those continue. So big thumbs up for direct cash grants. Several questions around absences and subsidy reimbursement for absences as families and children have to quarantine for COVID and they're away for 14 days. How is that addressed in terms of reimbursement? Programs are really encouraging reimbursement based on enrollment rather than absences. So can you speak to kind of that bucket of policies?
Yeah, I'll start, and Jenna, feel free to jump in. Given the unique circumstances of COVID and quarantining, I think that is one of the changes that we're looking at making and being able to fund through this next round of funding from the federal government, is to significantly increase the number of the idea is to significantly increase the number of absences, so we sort of take that stress off the table. So that's the idea.
Yeah, and I would add that I think that is encouraged by the feds. I think, to Commissioner Storen's point, we've heard this is important. I also think as we think about building back better, using this data and understanding, I mean, one of the things that is not great practice, as all of us can account for, is sending kids to childcare sick, even if it's not COVID, right? And I do think that sort of structurally, by being potentially overly strict on absences, we are incenting behaviors that we don't want to see. And I feel like when I talk to childcare folks now, there's a sort of it feels like kids are getting less sick, and we're hearing from pediatricians kids are getting less sick because of more frequent hand washing, right? Sort of a little bit more distance. Some of those things we think will go away, but I think this ability, right, to say if you're sick, there shouldn't be a financial reason for you to come in, right? That a child should be able to stay home is something I think that will even outlast this immediate pandemic and can be one of those areas in which we build back better.
Great. Love thinking about building back better. On that note, a couple questions around eligibility for child care subsidies. As parents lose employment and they are doing job search activities and they lose their subsidy, difficulties getting back on, are there things we can do to help them stay on subsidy while doing important things like job search?
So we currently have a policy in place that once you enter the subsidy program, you're on it for 12 months. So any family that was receiving subsidy whose parent has lost a job, over that period of time, continues to be on the program and receive it. To the specific point about new applicants whose parents are looking for work, that is one of the policies that we're both looking at here in Virginia, and we'll need to talk to our federal partners about the flexibility to do that. So it's great to hear that suggestion, because that was been part of our conversations today.
Great. Jenna, anything to add, or ready for the next question?
I think the only thing I would add, and having had the opportunity to run this program in another state, it's almost counterintuitive, and I know that Commissioner Storen and I are on the same page here, and it's good to hear this from folks. It's very hard to get to full-time employment if you don't have full-time childcare first. And I think when we particularly think about the families who are on our subsidy program, and we know that you're working with them day in, day out, but your ability to take on a different shift, right? Take on another shift, take on that additional responsibility hinges on having stable childcare. And so I think we're trying to figure out, noting today that there's a desire for us to look at something like how do we support families who want to work, right, but are not maybe sort of currently full-time, sort of fully employed. How do we think about, explaining that doing that can help you pursue more self-sufficiency for your family, because that's the only way you're going to be able to kind of to be successful at work. We saw data in another state where we lowered the work hours requirement to start, because the evidence suggested that, by lowering it, allowing people in earlier, you actually increase the likelihood that they'll work more hours, because they have that, they can depend on that childcare. So it's really good to hear that, Karen.
Great, thanks. A few folks have asked, about families that just missed the cutoff for childcare eligibility. The increasing pressure on families who are still low to moderate income and really can't afford childcare. How can we address that?
We do have flexibility in federal policy to raise the income eligibility threshold. So there is some opportunity there. Our eligibility varies by region, and but there's still room in each region before we hit the federal limit, which is 85% of state median income. So, it really becomes kind of a numbers game of which you can afford in the long run, in terms of being able to, serve and not have these big sort of massive waiting lists, and to continue to focus on serving those with the greatest need. So I'd say one of the policies that we're kind of considering and doing some analysis on is, can we raise, even if it's temporarily because of the unique circumstances, could we raise in a targeted way some of that income threshold, maybe for younger kids, or raise the thresholds in another targeted way. So, and then kind of see what the uptick is, because that's the latent demand for child care subsidy is really hard to estimate. Jen, I don't know if you've got anything to add to that.
Yeah, I would add that the commissioner is right? I mean, we want to be able to fund folks at a rate that covers your costs, right? Because we know that funding you at 60% or 50% of what it costs doesn't increase access, right? Because then parents have to make it out, have to pay for it out of pocket. We want to serve as many people as possible, right? But ultimately, it's that there's always limits there. But I think with these additional dollars, there's a real openness across our agencies and the governor's office. I also want to note, and think it's really important, that when we think about those types of decisions, we do it, and we try to think about the impact on some of our most vulnerable kids and families. And so right now, we run a subsidy program that 2/3 of the kids that benefit from it are kids of color, right? I mean, it has been a really important lever in supporting families of color to be able to, succeed in the workforce, to support the development of their kids. And so we want to kind of honor that and be thoughtful. We know that it's more expensive to serve infants and toddlers, right? And our numbers are lower there. And so really kind of getting at the right rate and who should be eligible, and how we make sure that we don't crowd those kids out. We know that it's more expensive to serve kids with special needs, right? We know I think we set different rates by different communities, not to sort of be inconsistent, but because they're different cost of living, you have to pay your staff differently. So, we are running those numbers as we speak, and just want to emphasize that, that both the commissioner and I feel very strongly that, we want to build a system that serves well those who are furthest from opportunity, right? And we feel very strongly that this sort of, for many families, the child care subsidy program is the sort of funding of last resort, right? It is the thing that they need to be able to work or go to school. And it's balancing between needing to serve a broader set of families, right, who need childcare, but also making sure that we sort of carry forward our responsibility to those in most need. So we're hopeful, right, Karen, with the additional dollars, that we can solve for more of this pain, and know that we're trying to constantly balance equity and quality and access as we make these decisions.
Great, that's really terrific to hear. A few people asked about covering parent copays. Will that be extended? How will you all approach that in the coming weeks and months?
I would say that's another policy that we're considering, with the new federal stimulus dollars.
Mm-hmm.
So.
Great, thank you. Lots of questions around school-age childcare. Obviously the increased cost that come along with it. How long will people be able to access funds to support school-age childcare? What will happen if virtual learning continues into the fall? I'm sorry, I'm throwing a lot of questions, but let me just do one more. How would you advise providers to adapt when they've got kids who are now going hybrid? So they're in the schools a couple days a week, and then back in the childcare programs a few days a week, in terms of safety and precautions and so forth.
So these are all really good questions, and they're all very challenging. I wish there were clear, simple answers. The very first question you asked was about how long the funding will be available for. So we have about $33 million that we've set aside to support this effort. About half of that will need to be spent by June 30th. So about 16.6 million total, and that's because it's state general fund dollars that expire at the end of the state fiscal year, which is June 30th. We spent about 4 million of those dollars to date. So I am pretty confident that we can continue to build on that success. And the other $16.6 million is funded out of a different pot of money that has a much longer time horizon. And that would take us past next fall if we needed to do so. So I think there'll be money in communities. Maybe there's never enough money, but it is a fairly significant amount of money to use. In terms of the model of how you provide services, how you keep kids safe, I think we are learning. We're seeing those, and we're learning from what's happening out in communities. So while we can observe and kind of put out best practices, I really think those best practices are coming from the people on this call on how to keep kids safe, how to use, how to support kids in their hybrid model while they're in care, and how to stand up new care. Jenna, other thoughts?
Yeah, no, I want to sort of, again, really deeply appreciate everybody's flexibility and being able to adjust. It's both a wide range of approaches being used, and it's a constantly moving and switching, right? They're in person 5 days, and then it's hybrid, and then they're virtual, and and we know each of that requires you to quickly change operating practices. I think I will say, and I think the commissioner, I both firmly believe we have to address this public health crisis, right? Because we have to get things back to whatever the new normal is, which it would include school-age kids back in public school, 5 days a week. And I think on the education side, the state superintendent is working very closely with the Secretary of Education and the Department of Health and the governor, when safe and with safety practices in place, but kind of getting, as many kids back into school is critical, particularly for our younger learners, because it's just disruptive for the economy, it's disruptive for kids and families, and it's disrupting kids' learning. And we're seeing really concerning trends in early childhood and early elementary that we've never seen before. We've never had an absenteeism problem in elementary school, and we now have one across the Commonwealth. We're seeing kids with lower literacy rates and skills. We're seeing kids that are in trauma and stress, and we know that a lot of this has to do with all of the disruption and all of the change and the challenges faced right now. It has to be safe. It has to be kind of safe for kids to be back in school, but I would say that there is a concerted effort prioritizing both childcare and K-12 educators in 1B is part for vaccines is one of the steps, and noting that as well as thinking about how to use federal funding for extended session for schools, but I think there is a goal to get kids back in school when safe, and a lot of urgency around doing that, because we just know it has put you guys have been incredible, but it's put you in a really difficult problem, sort of situation in terms of space and broadband and all of these things that, that some of which will be useful in the future, but it's also, many of you would say, I'd rather go back to just my solid, during the day it's birth to 5, and after school it's the kind of other ages, and that's what your facilities are set up to do. And I think that that's something that our K-12 system is also working to get back to too.
Great, thank you. Since I lobbed multiple questions at you at one time, I'm going to throw you, I think it's a softball. Now that the PPP and CARES 1, 2, and I guess some or all of 3 have been out, we know that PPP is non-taxable. Could you please let us know whether CARES grants are treated as non-taxable as well?
I'm gonna phone a friend on that and get back to you just to make sure I give you the right answer. So
Yep,
I think they're
agree.
non-taxable, but I'd like to check with my CFO. Yeah.
That seems fair.
Not
Okay.
not a softball at all. Yeah.
Okay. All
I feel
right.
like I should know that answer, but I don't. Yeah.
That's great, and hopefully that information can be, distributed to the fields as a follow-up, so they know whether those CARES checks are tax exempt. Another question, a number of questions around vaccines and access to vaccines, and I know you all touched on this a little bit, but it is coming up a lot in the comments. What can we do as a community to make sure our child care providers have access to easy access information, a clear path to getting their vaccines? Do you all have thoughts or suggestions on that?
So I'll start here. I think it might be helpful to explain kind of what we've done so far, and then I think would like to sort of share a few thoughts on, as we've realized, I really think in the last few days that folks are facing real challenges, what we can do going forward. So we have jointly advocated the Department of Social Services and Department of Education with the Department of Health to make sure that childcare, both in centers and family day homes, were fully included and recognized as early as possible in terms of the vaccine priorities for the state. And so, making sure that group was included in that first set of non-healthcare essential workers was our first priority. And I know that both the commissioner and I advocated for that. And really, and I know we've got Cheryl and others on here making sure that they understood that family day homes were absolutely included, right? It might be a smaller number of kids, but they have been open and doing a heroic job throughout this pandemic and absolutely need to be a priority. We have also shared all of our numbers. So kind of any information we had about numbers, we estimated staff, we went high end in terms of how many staff you had based on the capacity. So really kind of thinking about making sure that they knew and they understood the supply that would be needed, and shared all of that, again, down to the health district level with the Department of Health, and they have a full vaccine coordination team, and then they've shared it with local departments of health. Our understanding, we've heard a lot. We've heard from the Child Care Association, we've heard from the Family Day Association, we've heard from Health and Hospitals this week, we've heard from superintendents, and I've heard from most recently Head Start that there's already challenges as folks have opened up to 1B, that they are just, people are either not hearing about how to make an appointment, or they're hearing that all the appointments are already gone, and and there's a real concern that somehow even within that group that childcare is less of a priority than, say, the school teachers. And so we're trying actively to think about how we can be clear that that is not true. We will share that the commissioner and I both understand that we thought we were going to one amount from the feds, and it's come in much, much lower than that. And so there's all sorts of things happening at the federal level that are putting states in a real bind. And I don't mean to make excuses for us, but literally, we had one number and we're prepared to deploy them, and across the state, health districts are just sort of, when they, it's like literally when you open the box, there's a lot less than what you thought. And folks are in a really impossible situation. They thought they were going to get 1,000. They realize when it gets there, it's 250, and then they have to turn 3/4 of the people away. So this is real, and I just want to sort of echo that and be candid, with our group about that. We are advocating with Dr. Avula, who was named last week, to be kind of point. I think as you've heard from the governor, we have escalated the importance of the vaccine distribution, and, first tackling the supply and then making sure that they get out there. And, we have reached out to VDH, and I think we'll be following up because, as we are hearing that there are issues in terms of even kind of getting through to your local health department and or, kind of getting an appointment. And really kind of if we would be open to hearing other ideas on, how we can advocate. We've planned for it. You are reflected as a priority. We've shared all your names and numbers, and yet we hear that it hasn't trickled down yet. And so, we look for some help and ideas on how to do that. And we will follow up, and we are following up with the health department and with Dr. Avula on how to sort of resolve this, noting that we have to be candid that there's just not enough supply right now. So everybody is really frustrated and upset, at least this week. Duke, what would you add?
Yeah, I mean, I think the bottom line is we have a supply problem, and we can improve communication. But I think really the biggest challenge right now is the supply problem. So when we can get that fixed, hopefully soon from the federal government, I think things will go much better. But please keep communicating with us so that we can help problem solve on a individual basis. Also, I did hear back from my CFO, the CARES grants are taxable. Just that wasn't the answer you wanted, but that's what the federal government, those are the rules that they gave us. Thank you.
Okay, so they are taxable. Heard a little dog bark right over that, but want to make sure that is clear. Thank you so much for checking on that. And we're going to pivot for a moment. We have a number of early childhood stakeholders on tap to also provide some feedback on ideas for use of the new federal stimulus funding. We're going to start off with Christine Johnson-Staub from the Center for Law and Social Policy up in DC, who has kind of a bird's eye view and national perspective of strategies that are being used and what Virginia might want to consider. Christine?
Thanks, I appreciate it. And I appreciate y'all making time today to have me. And this has just been a great conversation so far. So I want to focus a little bit on the new funding that just became available at the end of December that is not yet distributed. It's not, guidance isn't out yet. I know there's a lot of questions that remain. But I think, as you all said at the beginning of the call, there's both an urgency to planning the use of the funds because of the 60-day requirement that you let the Office of Child Care know how you'll be using the funds. And there's also, a big opportunity and to plan and use them effectively. And although there's no guidance, it does seem like they're very similar for the most part, to the CARES dollars that have gone out in the past. And there's a lot of language in the law itself that says how the funds can be used. So the things that I really have enjoyed hearing you talk about in particular today are uses of the funds that can both address the most urgent needs created by the pandemic and inform ongoing policies that are kind of always options under federal law, and the lessons that have been learned about the fragility of the child care system and what might be needed. Our first recommendation, and just as CLASP thinks about these funds with across the states, our first recommendation is to use what you know. And I know that Virginia has been so great about collecting data, both quantitative and qualitative data about how your dollars have been used, getting feedback from people about what's been useful, thinking about what's been missed, who's been helped by the funds, who hasn't. So I think that's, we're asking all states to kind of start with that, since the funds are so similar to the last round. What have you learned in the last 9 months that you can really apply to this new use of funds? And I think, a lot of the things that you highlighted reflect that. I know you have a really strong local network of voices through Smart Beginnings and through other networks of intermediaries, and that's a really great head start. Just worth taking a look at that and thinking about who's maybe not at the table or who hasn't been heard from yet, or providers that are out there, but for whatever reason haven't connected with the resources, and why that might be parents who may still be in need of getting access to childcare, and trying to fill in those gaps and think about where those gaps are. With that knowledge, I think, and the challenges that you, Jenna, highlighted a little bit earlier, it really feels urgent to target the funds to stabilizing providers that are operating at reduced capacity, as you said, to extending support to families to access the care that they need. And that, I think that the question about 12-month eligibility falls into that category of thinking about, how is that being administered? Do people know that they can continue to receive childcare? Are there any reporting requirements that are getting in the way of that? Like all of those kinds of things that might keep people from actually using it, and thinking about the job search eligibility as well. And then obviously supporting the workforce. And you talked about the challenges with turnover and with finding staff right now. So I think that's really obviously an important question to think about too. I would highlight continuing to use the funds to initiate or to continue policies that have helped parents with subsidies and providers who are caring for the children through the pandemic, and that includes the direct grants that you've been giving, but it also includes, as you said, the absent day policies. I think that's a really significant piece of continuing to pay by enrollment over attendance. The other way of kind of providing stable funds in a very predictable way so that providers can count on them regardless of utilization is through contracts. And I know you've explored this a little bit, and that maybe your legislature is considering a proposal related to contracts. I think that has been used in a few states, and I think many more are thinking about it now, mainly because of what they've learned through the pandemic about the stability of paying per child system. And so I think contracts are really a great opportunity to give consistent funding, to create a space where children aren't pressured to attend when they're sick, where families don't feel like they're going to lose their subsidy if they don't take their child in. It is taking that absent day policy consideration just a step further and saying, look, we know that attendance and it's going to be unpredictable for a while, that there are always issues that have families coming and going, and that providers can't be expected to sustain themselves with an unstable revenue. There's also some other, I think, possibilities around sustainability. There's the kind of technology pieces that the flexible funding can be used for, and particularly with school age providers, I feel like that is useful. And then looking at how your rates are determined, and the cost of quality model to determining payment rates, so that you're not again kind of paying them, you're not paying based on a limited set of factors, but you're really considering what it actually takes to provide care in this environment, with all of the health and safety measures, with providing continuity, and with workforce considerations, including paying providers and teachers and other staff the value of working during this time, which we know is stressful and requires a lot. I don't want to use up too much more time, so I'll just throw out again, encouraging the use of funding to support the workforce in a variety of ways. I think one of the lessons we learned nationally is streamlining any application processes for accessing funds. I'm not familiar with how the grants were administered in Virginia, but that's, I think, been a consideration and a lesson in other states, just making it as simple as possible, making sure you're reaching everyone and that they're able to easily access the funds. And I think I'm going to stop there because I'm probably out of time, and I'm happy to answer any questions if that's helpful.
Wow, Christine, thank you so much for such a comprehensive overview and thoughts. We've already gotten some comments in the chat about how helpful they were to hear those suggestions. And now would like to turn it to, a different perspective, a parent perspective. Tisa Thompson from Charlottesville, Virginia, is going to talk about her experience as a parent and what has been helpful for her and thoughts she has on improvement moving forward.
Hi, I am Tisa Thompson. I am a parent as well as I am also an educator. So my two suggestions would be, again, like has been mentioned before in the comments and the questions, just waiving the subsidy copay would be helpful, as well as also just making sure that staffing is available for those that are in the centers and for our providers that are caring for our children, as we are working to make sure that our children are educated and cared for while we're doing our job. So those were like basically the two things that I had that I wanted to share from my perspective as a parent and also as an educator who works with students virtually, and I witnessed some of the things that go on with our centers that definitely need the staffing and the support there to make sure that our kids are successful in all that they do. So those are my two comments.
Excellent.
Thank you so much.
Karen,
Mhm.
do you mind if I ask Tisa a quick question?
Please.
Tisa, I'm also a Charlottesville native and a product of the Charlottesville Public Schools, so very great to see you, and a parent of three. Thanks for those ideas; those are fantastic. I'm curious, as we're thinking about the efforts that programs have made to keep kids safe. Were there any things that your program did that helped you feel really good about bringing your child or children? I'd love to know your kids and their ages, bringing them back, and what did your program do to kind of make sure you felt that your kids would be safe and that you and your family would be safe?
I have one son, he's 4, and he's been going to the same provider since he was 1 year old. And that provider also cares for 2 toddlers who are children of a medical professionals. Both of their parents are medical professionals. And so she made sure that she was able to stay open to support not only my child, but also the children of that of the medical professionals. And so she followed all the guidelines, and she kept checking in with the parents as well as with the with social services to make sure that she was doing all that she could to do that. And then on the end of, like, as on the educator part of it too, they made sure that when the centers were available for our students, that even our administrators from the school that I particularly work for went to check in to make sure that they had everything that they needed for those that were staffed there. So we've been working as a team, as a community, not just of me as a parent, but as a professional, to make sure that we are making it safe for not just our own children, but also for the children that we work with, to make sure that we're still being able to provide them with the education that they need as well as the care that they need. So that's kind of what I've been exposed to in my experience thus far.
Thank you. I appreciate that.
Thank you so much, Tisa. We really appreciate it. And if you can stay on the line, you may get some more questions. But right now we're going to turn to Cheryl Moorman, who's the Executive Director of the Virginia Alliance for Family Child Care Associations, and hear from a family child care provider's perspective.
Good afternoon. Thank you so much, first of all, for having me on the call. And I also want to say thank you to Jenna and Commissioner Storin for first the CARES Act 3 distribution that was put out. There was a letter that was sent asking for an increase for the family day home providers. And I thank you for reading and hearing that, and also adhering to that and allowing us that increase, which was really beneficial to the providers and helping us to maneuver during these difficult times. So thank you so much for that, as well as the PPE that has been sent out across the state has truly been beneficial to family day home providers and early childhood educators as a whole. Trying to find those resources were definitely difficult, and that took such a great burden off of our shoulders by seeing those packages come in, especially around the holidays. So thank you for that as well. And so much has already been said as it relates to subsidy and for there to be based on attendance and enrollment. So I just want to make sure that family child care is in that as well, that it is not just looked at for a center perspective, but to know that family child care is should be included in that as well. Also, the other things that I would like to add would be to make the amounts of the subsidy, first that there be an increase, and then make them fair and equitable based on the actual cost and needs without burying us in the paperwork and the receipt verification. Would be truly helpful. As family child care providers, we know that most of the time we are the all in all. We are the, we're the cook, we're the educator, we're the, there's an additional staff that is going to help us with all the things that we have to take care of in the course of the day. So tacking on additional paperwork is an added expense or burden for family child care providers. So keeping that in mind, so the increase for subsidy payment rates, as well as paying family child care providers, as we said, based on enrollment and not attendance, and also cover parents' child care subsidy co-pays for those who requested due to the impacts of COVID. We find that a lot of times, because the daycare center's subsidy rate is so much higher than a family day home provider's rate, that even when they come to a family day home provider, they see that there is still a difference in the cost as well as the amount that subsidy allows. So that difference between my rate and the subsidy rate is the parent's expense as well as the copay. So the increase in the subsidy rate would definitely help where that is concerned. And also backing up to a comment that Commissioner Storin touched on regarding the increase in the subsidy rate for level 1 providers. Unfortunately, I do not think that family day home providers were included as a part of that. From my understanding, it applied to Virginia quality recipients if you were at least a level 4 or level 5. And to my understanding, there were no level 5 family day home providers. So therefore, we were not a part of that increase that may have been given. So as we're looking at that, looking at everything across the board, we want to make sure that family day home providers are included and are a part of the changes and things that are being put into place as we serve the kids in our community and across the state. So thank you for listening.
Cheryl, thank you so much. A big shout out to you because you are, running your family day home as you provide, these important experiences and insights. So thank you so much. Jenna, Duke, any follow up to Cheryl's comments? Or we may just go ahead.
Yeah, just to thank you for the advocacy. I mean, I do think that the commissioner and we heard and know that on behalf of the association, figuring out how to address the way in which we structured the reimbursement or the direct cash assistance and the rates was largely driven by the data that we saw on the ground, how many family day homes were open, and just scrambling everything, as well as spending some evenings and Saturdays with Cheryl and the folks in the association. So we every bit of advocacy that Cheryl shares with us is just extremely useful as we are making these decisions.
Yeah, thank you. And I'll have to check on the rate increase for level 1, because I do think family day homes are included in that. So let me, double check that and see if there's some nuance within that I'm not aware of, and we'll get back out to you through VECF. But the feedback is, really helpful. So we really, really appreciate it. And I have also heard that the pushbacks of, PPE and cleaning supplies were helpful. And I think that's something we'd like to try to do again. So.
Thank you so much.
Next up for some comments is Jake Stewart with the Early Care and Education Consortium, a national group that represents providers across the country. Jake, welcome.
Hi, Commissioner Storin and Officer Conway. I'm not sure the best title. Thank you so much again. I echo everyone's gratitude and you all being here to solicit our feedback. As mentioned, the Early Care and Education Consortium represents about 240 licensed centers in Virginia, but also licensed centers across the United States. So we've been able to see kind of how other states were able to utilize their CARES Act funding and find what worked and what didn't work. First and foremost, another special gratitude for the grants that you all were able to utilize in the CARES Act funding. It was incredibly useful, and I think it would be something similar to that program would still be incredibly useful, but basically that grant program on steroids, essentially. As you know, the providers are struggling. A recent NACI survey found that 57% of providers currently in Virginia are losing money every day that they're open. Nationally, enrollment is down by about a third. And in Virginia, 53% of open providers are unsure how long they can stay open. Staffing, not only is it difficult to recruit and retain staff, but staffing is still one of the largest budget items. It always was, and it's just grown since the pandemic. And of course, I think the other doomsday scenario for a lot of programs is that rents will need to be paid. Those have been delayed for a long time, and that is still an upcoming expense that needs to happen. So in addition to that, I think, we all know that the health of the early childhood system really relies on the diversity of its programming. So ranging from centers to family day homes, both subsidy and non-subsidy providers. So as you did before, just making sure that the funding that comes with the new federal funds is open to all of those providers, trying to avoid, and this goes with a number of states, trying to avoid applications on a first come, first served basis. We've seen states that were able to make it a fairly automatic process based off of the licensing data or data systems they have on the providers that were there. The more automatic and seamless that you can make it for providers, really the better. So we just encourage that. And then finally, in terms of the federal funding that is coming, something that we haven't really heard spoken a lot about in the media or really a lot of states is that in addition to the $10 billion fund equating to about $200 million for Virginia, the federal government also increased CCDBG. They increased the annual appropriation for CCDBG. And in addition to that, it's the fourth consecutive year. If we go back a few years in fiscal year 2018, Congress historically doubled the CCDBG program. And I know a lot of states were really worried if that funding was going to be taken away at some point. They've spent a lot of the funds on one-time investments. But now this is the 4th consecutive fiscal year that Congress has either sustained or increased those funds. So I think what we're seeing from the federal government is a commitment to continuing to fund this program. And I think what that means for Virginia is that through the annual appropriation, they can start making a lot of, the Commonwealth can start making a lot of bigger, bolder investments with those CCDBG dollars, which include a lot of the recommendations that those before me discussed that could come from the annual appropriation. So just wanted to remind you all, and you all probably already know, just about that increased appropriation, and really thinking about how it pairs with the $200 million and how to best maximize both streams of funding. Thank you so much for the opportunity.
Thank you, Jake. Really helpful to hear from you. Next up, Abby Rogers with the Virginia Alliance for YMCAs. They do a wide breadth of work with children of various ages. Abby, thanks for being with us.
Thank you so much. I just want to say thank you starting off to that. You guys have been very responsive, very flexible in trying to help keep childcare providers open during this period of time. And so just, I can't say thank you enough to begin and start there. I think we've heard a lot of the different things that we would have hit on at the YMCAs, both in our early learning sites as well as in our after school and before school sites as we go forward. But just a couple of things that I think as we look at how can we build it back better, that we might be able to focus on a little bit. In the immediate space there, connecting efforts. I know that you guys are working so hard to make so many different options available in different places, but sometimes those options aren't connected. So the one example I'll give you is with the emergency licensing for childcare virtual learning sites. But then those sites that we worked with school systems to set up quickly because of their access issues weren't available for the reimbursement because they weren't technically licensed. And so how can we take all of the options that you're giving to try to create space for students to have spaces and make sure that all of the funding is tied together then at that point. And I think that would be an important thing to really leverage all of the options you're giving to providers. And so then if we look forward a little more, because I think we focused a lot on what's happening right now, I think the reimbursement for DSS is going to become important, because I think if we're thinking holistically about how we're doing this work going forward, it's going to be more expensive. If we know the minimum wage is coming in, and we're not paying our staff minimum wage, but compression is going to come into that. And so as that comes up, the cost to hiring, we're already having problems hiring. And so with that coming through, then those numbers are going to rise on that. But I think if you also think about the equity gap that we're learning with our kids, they're going to come back and there's going to be an education issue. We've heard a lot about what the learning that is not happening and the increased number of absences, as well as kids not doing as well in the grading in the schools. And so for us, we're really looking at how in that school age child, we're going to wrap around in a different way. And so how are we creating curriculum that's going to do that, which is an additional expense? How are we doing additional training for our staff and trauma-informed care right now with the mental health issues that you continue to hear about those spaces? So if we want to create the access for our providers to really have that holistic vision, how are we helping them ensure that they can fund their program fully as it is now, but then also think deeper about what our kids are going to need coming out of this space? So I think those are some of the things that I would put out there as you're thinking about building back better. I agree with many of the things that have come before, the questions, as well as the other panelists, on things that are important for right now. The funding on enrollment, not attendance, is huge. And I think the opportunity that you guys have given us to be able to fund on capacity here in the beginning, when we knew we couldn't fill our capacity, was life-saving for many of our different organizations. So how do we think through that in the future as families are still feeling fearful about sending kids back, maybe even potentially into the fall? So I'll leave it there because we've had a lot of great comments already. But again, I'll just end where I started with saying thank you very much.
Thanks, Abby.
Thanks so much, Abby. Appreciate those comments. And we'll move on to our final stakeholder perspective, who was insightful enough to realize she might not be able to be here in person, so she provided a slide, which I will help. So Emily Griffey from Voices for Virginia's Children is waiting virtually alongside Kathy Glazer to provide really important testimony and support for a bill that's going through the legislature right now that would make background check portability more feasible and provide a pilot for contracting. So two things that really we believe will help support and strengthen the childcare industry. So Emily and Kathy couldn't be with us, but Emily, as the strong advocate that she is, wanted to make sure that we had an opportunity to see where Voices for Virginia's Children stands on some of these issues, many of which have been emphasized with other speakers today, but certainly to waive or reduce parent copays, extend the number of allowable absence days. We've heard that one a lot. Expand eligibility for subsidy doing job search, award contracts to providers to stabilize and reduce costs, which this bill is trying to address, make grant awards based on costs, not enrollments, and fund one-time costs with long-term improvements. The wrap back that she mentions there in parentheses would really significantly help with the background check portability. So those are some thoughts from Voices for Virginia's Children today. And we have a few minutes left, and we have hundreds, literally, of questions and comments for you. So I want to hit on some of the ones that seem to pop up a lot, and also some shorter ones that maybe we can do a speed round. So first, someone commented that many of the materials around the CARES grants were provided only in English. Do you anticipate being able to do some other languages?
Yeah, I think we're looking at doing Spanish as a second, and then making sure that we've got our translation services available for other languages.
Great, I know that is really important for our provider community as they try and access information. Several people recognized kind of the growing social and emotional impact that the crisis has caused, as well as the growing number of children with special needs, and how can providers be supported in supporting both children and their social emotional needs, as well as children, with identified special needs.
Well, Karen, it's interesting that this didn't appear on Emily's slide, because I know this is something that Voices has really been advocating for and worked very closely with the delegate and head of the House Appropriations last year around looking at early childhood mental health consultation, which is a lot of words, but at its core, it's a model that really seeks to support both the kid and the family, as well as the child care provider. And so it's an intensive coaching model where you come out when the adults find the child's behavior challenging, which I think we're going to see a lot of, and you guys are already seeing if you're currently open, and we're going to see a lot more as more and more kids come back to the system and full time, really thinking about how do you both address the needs of the child, but also support the educator to deal, right? Because with like when a 3 or 4 or 5-year-old, has a meltdown, it's about what's going on in their life, right? That none of it's personal at that age, and really equipping our educators to manage that behavior. I think a lot of the behavior we're going to see is sort of in between the level of intervention that needs like therapeutic services, but is still greater than what we typically see, right? I mean, anytime you have this level of unprecedented societal stress, that we're likely to see that. And so we created a document for the General Assembly on how to build a statewide model of that. We have examples of that with the Infant Toddler Support Network, and certainly the folks who used to work at DSS who now work at the DOE thinking about improvement are currently grappling with that question and thinking about how do we, across our various, from the scholarship to the Infant Toddler Support Network to potentially new things like this model, could support all of you to work with kids, knowing that they're going to bring a whole new host of behaviors that are going to be tough to work with, and we really need to support those emotional needs first before we can even think about supporting learning.
Great. Thank you, Jenna. A few questions have come in recognizing that minimum wage is going to increase later this spring, and that will have an impact on, providers' rates. How will subsidy take into account, the increased pressure on providers, which is, a good thing to, increase the compensation for our early educated workforce, but, it has a necessary impact on the bottom line.
Mm-hmm.
So, we base our rates on a market survey that we do every 2 years. And so there is a mechanism for us to sort of reset the rates based on the reality of what's being charged in the market. What's being charged in the market, it's a reflection of all the inputs that go into operating the business, including labor costs. So I think that there is a mechanism. It might be a little bit of a lagging solution, but I think the way, I think it begs a larger question that we've discussed in forums like this and throughout the executive branch, which is, is the market rate really the best way to set the rates for the subsidy program? I think it's, because it doesn't actually, reflect the true cost of care. And so it's a challenge. We do operate within the construct of the kind of law and regulations that we get from the federal government on this. And so I think, the new administration is open to sort of dialogue on all sorts of issues related to how we best both support the child care industry as well as low-income families. Jenna, I don't know if you've got anything to add there.
Yeah, I think the only piece that I would add is that, we'll be looking at this very closely, as this will also later this year and in future years, providers will be coming into the new statewide measurement and improvement system and really understanding, how each of our requirements from licensing to on a minimum wage affect your cost of operating, and how we make sure that we are, funding based on that, right, is critically important. And I think when I saw, Emily's point about some of the investments, right now we know because of an older system and a paper-based licensing system, you spend a ton of time and there's a cost, right, to doing that. Like technology can help us solve some of that. We'll be thinking both about how do we calculate these costs and also reduce any other costs, operating costs that, are within our realm of control or we can influence, while I think grappling with the longer term challenges the commissioner noted around what are the best way to fund you to kind of meet the health, safety, and quality expectations that the state is setting for you.
Thanks a lot. I know that topic will definitely be staying on the horizon as we approach that date. A couple people had questions following up on your comment about PPE. Several people said, thank you so much for the supplies of PPE. Others said they still haven't received them, and will this be continuing?
Yeah, we're looking to do another round of PPE, and please call your licensing inspector and let them know that you haven't received it, and we'll problem solve around that.
Thanks. Any additional information that you can provide regarding grants or funding related to school-age childcare? A couple folks, are wondering, where do they go to get information about that? How would they apply for that support?
So that's being sort of managed through the Smart Beginnings Coalition. So those anchor organizations in communities across the Commonwealth that are the kind of fiscal and backbone agent for Smart Beginnings would be the best place to go. And that's on the VECF website.
It sure is. And for folks, that's vecf.org. All righty. When will the CARES 3 grant money be dispersed?
So the vast majority of the third round was dispersed right before, or at the very end of December. We put out about $32 million of grants to any provider that had received a grant in CARES 1 or 2. And then we opened up an application at the beginning of January for any providers that have not yet received a grant. And, we're approving them on a rolling basis. Since the beginning of January, I think we've already approved about 400 additional providers. So go apply.
Great. Thank you so much. We're coming up to the end of our time together. And again, want to say thank you for all of the feedback and questions and comments that folks shared over the last hour and a half. We have captured those and we'll be sharing those in writing, all of them with the Commissioner and Chief School Readiness Officer. So even if your comment or question was not addressed, they will see it. And a final thanks very much to Duke and Jenna for their time with us today and thoughtful responses. I know they appreciate everyone's partnership as they do their best to make sure these funds and the support needed by the field is as helpful as possible. And many thanks to our stakeholder perspective folks who were on the call the entire time with us and brought us some valuable insights into this effort. So thanks to everyone. Have a wonderful afternoon. We'll be sending out the slides and recording later today. Thanks.